Okay, so this next video we are talking about the approach to toddlers, right? So toddlers being anywhere from a year old up to about 3 when they start preschool. So again, another vast state of change, right? A 12-month-old is very different than a 2.5, almost 3-year-old. So we have to take that into account when we approach. But with toddlers, the approach is going to be like when we mentioned with infants, older infants, they develop around 6 months, that stranger separation anxiety. So that's definitely still going to be intact with all of our toddlers, right? They are also very curious. They are very interactive. They are learning about the world and they crave being independent because now they're hopefully mobile and moving around, very purposeful movement. They explore everything. They like to explore lots of things with their senses, which includes taste. So they are going to be putting things in their mouth. So we have to think a lot about safety with our toddlers. Up to about age 3, it's kind of general practice on the pediatric unit that you will probably find them in one of the cribs with the toddlers, right, to keep them safe. So you may walk in and they may be on the couch bed with parents, but you'll probably more than likely see a crib in the room. So if they are in that crib, you need to think about making sure that the rails are up and the tops are down, because if they are standing up and mobile, they can crawl out of that crib or fall out of that crib. So we're going to think a lot about safety, whereas our newborn infant, our baby in the bassinet, if they aren't rolling over yet, we're still going to keep them safe, but we don't have to worry as much. This toddler is going to want to explore and get around and do what they want to do. So we have to make sure that they're safe. All right. So again, with our approach, because they are very aware of strangers, they are very worried about being separated from their caregiver. When we come into the room, they're going to probably be very leery of us. They make associations. So scrubs tell them a lot, right? If they've just had an IV placed or just had people coming in and touching and doing a lot of things to them that they did not like, and they were in scrubs, you're in scrubs, they're going to associate with you with what they did not like. So it is okay if the minute you enter a toddler's room, they scream, no, or go away, or they cling to parents. That's developmentally appropriate and it's okay. Don't let it hurt your ego if they yell and scream at you or push you away. It's appropriate and that's what we expect. So don't get your feelings hurt when working with toddlers. It's okay. Another thing that you need to be, again, is that detective, and you gotta kind of be a ninja with toddlers, because we need to make sure that everything we're doing looks fun and looks like a game, and we're giving them the opportunity to move around, to explore, to learn. So we have to incorporate that into our assessment and our approach. Because they may be very fearful of us, we don't need to go directly to them and start trying to build our rapport. Our rapport is really important with our caregiver. So if we enter the room, we're going to acknowledge if we see the baby doing something, we might be like, hi, but we're going to go right to our caregiver and we're going to ask them questions and we're going to start to build our trust and rapport, because you'll notice that toddler is going to be keeping a really close eye on you and their important caregiver to see how they react to you. So if they are calm and you're building rapport with them and they see that their caregiver trusts you, they will perhaps trust you a little bit more. Now, will they still probably be upset when you go to do things with them? Probably, but that's okay. So we have to think when we go into a room with a toddler, you need to have a plan A, a plan B, and a plan C. So you need to make sure that your backup has a backup plan. You're also going to want to think about bringing in reinforcements. So this is a great opportunity for you to pair up with another student or bring your instructor with you. We're always there for you in the clinical setting. If you need us and you're walking through doing an assessment for the first time, 100% we will come in with you. But you can also grab phone a friend and have another peer come in with you, because distraction is going to be key with these toddlers. So like the infant, we kept them as comfortable and content as possible. Same thing here. So if our patient is playing with a toy or engaging with their caregiver, we're going to continue to let them do that and start with our across the room focus. So I'm watching this little person, I'm watching them play, I'm watching them move around. If they start pulling up in the crib and standing and walking, I'm seeing a lot of my assessment pieces. I'm watching them for, limping or how they're bearing weight as they're moving around. I'm watching them play. I'm listening, right? Toddlers begin to babble. Then they move to talking. So I'm listening as they engage with their caregiver, and I may encourage conversation so I can hear that. So I see where they are developmentally and cognitively and physically. All right, so that is kind of how we're going to approach. So a quick example of that would be if I were to come in the room, I would do my AIDA, knock, knock, hello. Same way as I did with the infant. So I would come in and be like, oh, hello, hi, my name is Andrea, and I'm gonna be the nurse today for Michelle. So just got a couple of things to do really quick. I see we're playing with a toy there, and I hear Bluey on the TV. I love Bluey. I love Bluey. So I'm gonna just grab a couple of pieces of equipment. Okay. We're gonna let Michelle play. You guys just keep on playing and hanging out, and I'm gonna work around you. Okay, so I'm watching how they're playing and interacting, and then I would come in and start doing things. But while I'm standing here, I'm gonna get closer and closer, and I'm gonna look, and now I'm gonna ask my caregiver questions like, so how was Michelle's night? Did she sleep okay?
Yeah, she woke up a couple times. There's a lot of noise here.
Yeah, it is pretty noisy. How did you sleep?
You know, when she wakes up, I wake up, but otherwise fine.
Okay, well, if you need anything, because I know it's probably a long night, I can get you coffee, or we've got lots of students here to help us out, so we can get you anything you need as well. You've got a busy job here taking care of
her. Mom will be here shortly. She just wanted to run home and take a quick shower.
Wonderful, okay. So has Michelle had any breakfast this morning?
Yes, they brought in a tray, and she kind of ate a little, but not a whole lot.
Okay, that's all right. How about drinking?
Yeah, she's drinking good.
Excellent. All right. So how much did she have, a bottle or a sippy this morning?
Sippy cup, and she drank. There was juice in it, apple juice, and I think she drank the whole thing. Yeah, she did.
Okay. All right. So Mom, as she feels a little bit better, and it's hospital food. It's not what she's used to. Right. More concerned about her drinking, so that's the important thing. Sounds great. Have we changed Michelle this morning?
Yes.
Okay. All right. And was she wet, dirty?
Just wet. Yeah.
Just wet. Okay. Was it typically what she wakes up?
Oh yeah, she was up with a full diaper.
All right, that sounds like she's nice and hydrated. Sounds good. Okay, so I am going to then start walking through more of my assessment, and then I'll show you, again, we've talked about the equipment. So you guys just keep on playing here, and I will kind of walk through those equipment pieces for you. So again, Michelle is nice and entertained, so I want to think about doing the things that I can do without putting a whole lot of equipment on her right now, because she is busy. She is doing things that she wants to do, and so I'm going to continue to watch her for that, but just going to put on my little stethoscope. And I may be able to show this to Michelle, and like they are curious. She may touch it, she may want to feel it, and if she does, that's okay, yes. And then I may have a piece of equipment or something that I could let her see. I think I have one, excuse me guys. That little hammer, it's okay. So if I have something that she can safely play with, I could let her do that, or continue to let her engage with a toy. And then I'm just gonna skip around to the back and take a listen. So again, I've got my stethoscope in, and I can just start making sure it's warm. Hey Michelle, what's your toy's name? Does he have a name? Oh, he's so silly. And I'm listening, and I'm watching, and I may be able to reach around the front, or I may come around this side. Hello, oh, boom, 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 boom. And again, I'm walking through respiratory rate, I'm doing heart rate, and I'm touching the skin as much as I can. I know, and now, let's see what your breakfast is saying. Is it talking? Is there a cricket in there? Okay, so I'm saying silly things that I'm doing, I'm touching them, and I'm still continuing to have them be very busy. So I've looked, I've listened, I've felt, and now as we're moving on to the other pieces of equipment, again, the temperature and blood pressure are going to be probably the things that annoy them the most because they have to hold still. All right, so let's start with getting a temperature. So again, also we're going to be doing axillary temp because not many 1 to 3 year olds are going to be able to do that under the tongue. So we're going to use that armpit. So I might say, oh, is he ticklish? Are you ticklish, Michelle? Can I see? Oh, tickle, tickle, tickle. I know. And I'm going to keep that arm down. I'm making sure I've got the probe in there in the middle. And I may have to, say, keeping her distracted, or I may have to turn on the iPad. And then once it beeps, okay, all done, all done. So we like to let the toddlers know when we're all done doing something if it's upsetting them. All done, no more, all done. And so now I'm going to choose my piece of equipment here for the blood pressure. And pull socks, they're going to be the same. You'll just notice this is a little bit bigger than the one we used on the young infant. And we have to think about, or this may still be the size depending on, this is kind of a bigger baby here, but you will pick out the one that is the most appropriately sized. Now, this is our pull socks, and remember we mentioned, you're gonna look at those toes. They may or may not be like the right size to use this piece of equipment. Remember, we've gotta have it directly across from each other, and it does light up. Sometimes you can use that to your advantage, and we can look at it and be like, oh, look at that, right? Or we can maybe use a thumb, but if we have a toddler, these upper extremities are usually very busy, right? And they have, fine-tuned pincer grasps, and they can pull things off. So the minute you put a blood pressure cuff on the upper extremity, guess what's going to happen with that other hand? Probably going to reach around and yank it off as you're trying to put it on. So again, why distraction is so important. So we're going to entertain here. We're going to let her continue to hold and touch and play with her toy. And then I am going to work down here quickly and quietly putting that pull socks on. All right, and if they have socks, I might put those socks back on and make sure that they're really being distracted here. I may even join in on the game while I'm watching the monitor, come up to make sure I've got a good reading, and then I'm gonna go with my blood pressure. Now, with a toddler, a blood pressure, again, is going to be really, really one of the most tricky things because, again, they're going to move this around, they're gonna move this around, they may try to stand up, and that's gonna make it difficult, but we're gonna try. Okay, we ask that you try at least twice and let us know if you're unable to assess a blood pressure. Please do not chart a blood pressure that is crazy high. You're gonna get some readings like 130 over 100, right? Don't chart that. That is most likely because your toddler is fighting you or moving around or squeezing their arms or doing something to falsely elevate that blood pressure. So we're gonna try that. And again, if we can't get a good reading, you're gonna let your instructor know immediately. We're gonna let the nurse know. We tried, the baby was kicking, screaming. She may ask us to document that, but only after we've talked to her about being unsuccessful at getting a good blood pressure reading. All right, so those are our pieces of equipment that we're going to use to, that are, like we talked about in the infant video, very similar. We just have to think about more distraction here and utilizing our caregiver, utilizing friends to help us get our assessment. Another thing with toddlers, especially when they are a little bit older, like I said, they're vocalizing, they're talking. We are still going to be very respectful of their bodies, okay? So we're teaching them early that this is their body and we're coming in and touching it. So we give them choices and we ask permission for things. But does anybody know what a toddler's favorite word is?
No.
Okay, so we are going to give them choices when we can, but we want to make sure that those choices don't involve the option of telling us no. So I can't come in and say, all right, Michelle, I got to take your blood pressure. Is that okay? Because what is Michelle going to probably tell me? No. Now, your instructor is probably going to say, well, we need to do that. And now Michelle has just told us no. Your instructor has said, you got to get your vital signs, so I have to go back in there and do it. So now when I come back in the room and do the blood pressure anyway, I have broken trust with Michelle, any that I may have had. I've not done a good thing for my rapport, and now I got to do it anyway. So we want to make sure that we give them choices that they have, that don't have the option where they can tell us no, right? So we can say, I need to use this. This is my special band, and it gives the best hugs. It gives such good hugs. Do you want it? It wants to hug your arm. Do you want my special machine to hug this arm or this arm? Which arm needs a better hug, right? So if she says that one, okay, let's see how good of a hug our machine can get over there. Or if you're working with, an older toddler and you say, this special ribbon can tell how strong your muscles are. Which arm has the bigger muscles or which leg has the bigger muscles? Let them tell you. And now you have given them a choice, but you are still getting the information that you need. So again, we have to think about choice. We have to think about being flexible, and we have to think about changing our approach as things in the room change.